You're in the Charis Contraceptive Corner with Bale. So far, we've spoken about the different methods of contraception. We've spoken about your concerns or considerations and the different efficacy rates. Now let's really talk about the nitty-gritty, the pros and cons of each method. Why would you and your OBGYN choose one method over the other?
First, let's talk about natural methods. The benefits of this is that it's free, it's non-hormonal, and it doesn't require any device or surgical procedure. However, these methods can have a high failure rate because, as we said before, it requires a regular tracked period, a highly motivated and disciplined couple. Next up is barrier protection. And the number one benefit from this method is protection from sexually transmitted infections. However, once again, this can have a very high failure rate because of incorrect use, potential to break, and also requiring a disciplined, motivated couple.
So let's kick off the hormonal section of the talk. We're starting with pills, pills, pills. And yes, I said that 3 times because there are so many different preparations of the pill on the market. There's a combined oral contraceptive pill as well as the progesterone only pills. Now this method is common because there's so many benefits. It's short acting, it's reversible, it has great side effect profiles in terms of it can decrease your menstrual flow, it can decrease menstrual pain, it can help with PMS symptoms. And in the long run, it can even decrease your risk of having ovarian and endometrial cancer. On the reverse side, the pill can also cause some pretty bad symptoms too. Some persons may experience vomiting, bloating, weight gain, and of course, there's a big side effect or rare side effect, I should say, of blood clots. So despite being the most common method on the market, you should actually consult your OBGYN before starting any oral contraceptive pill.
Injectables. These are a hormonal method of contraception. It can be either progesterone or mixed preparation. However, you have to have time visitations with your care provider so they can administer this medication to you. Some of the benefits include that it's good for some menstrual symptoms, such as bleeding and pain. It's also 100% safe in breastfeeding. It's a very good option for women who can't remember to take a pill every day, and it's a great option for women in whom estrogen use is contraindicated. One of the number one cons is unscheduled bleeding. Some women have spotting with this method of contraception. Another thing to consider is delay in the return to fertility. Sometimes it lasts up to 6 months. Other things to consider is depression, weight gain, and osteoporosis.
Subdermal implants. Now this is the most effective method of contraception and it lasts up to 5 years. It's long lasting and it's reversible once removed. Now this method of contraception has a very similar side effect profile as well as benefit profile as injectable methods. So let me tell you some additional benefits and cons. Pros, it's not user dependent. You literally set it and forget it, but for 5 years. And cons is that it does require a minor surgical procedure to place it and remove it.
Intrauterine devices. These devices are inserted directly into the cavity of the uterus by a doctor, and they can be hormonal or non-hormonal and last between 5 to 10 years. The benefits include that they're immediately effective, not user-dependent, long-acting, and reversible. Hormonal IUDs have non-contraceptive benefits for women with heavy menstrual bleeding, hormone replacement therapy, and some with endometrial pathology. The copper T is good for women who have contraindications for using hormones. It's immediately effective and it can be used as an emergency contraceptive method. The cons of intrauterine devices is that it has to be placed by a doctor. You can also have some unscheduled bleeding. The copper T for sure is not for persons with heavy menstrual bleeding and if it's associated with pain. Also, if you have a sexually transmitted infection or you're at high risk for having one.
Sterilization. This method is regarded, or should be regarded, as a permanent method of contraception, used for couples who are sure that they are done, DON, N-E, done having kids. Or for persons who have exhausted other methods of contraception and are now sure that they want to move on to this method of contraception. This method works by blocking the tubes that transport the egg and transport the sperm in men and women respectively. So essentially, egg and sperm never meet. So benefits of this method is that it's not user dependent. Your doctor does it and then it's over. And it's permanent. You are D-O-N-E, done having kids after that. Some of the cons of this method, however, is that it does require a surgery and that it's permanent. And so some persons who decide that they would like to continue having children after having a tubal ligation or vasectomy may need to look into other methods of conceiving, like IVF and so on.
Thanks for joining us in the Charis Contraceptive Corner with Bill. Now, this was just the tip of the iceberg. There's so many more things to explore and discuss. Have you seen a contraceptive method that you like? Come in and have a discussion with your OBGYN so a method can be chosen for you and your family.